Welcome, everyone, to the UnitedHealthcare Global Return to Work webinar, where we'll explore workforce strategies for a post-COVID-19 recovery. My name is Erin Larson, and I will now hand it over to your host, Mr. Benjamin Hawley. Ben?
Thanks, Erin, and thank you for everyone who joined in today. And if you are returning to our webinar series, we did run a number of webinars on sort of the emergence of COVID and how it was tracking across the world and across the country. We've been hearing a lot of requests for information about return to work and wanted to bring forward a quick update for everyone on kind of the current state of COVID-19, but really focus this particular webinar on some strategies and topics to consider as organizations return to work or begin planning on returning to work and returning to business travel. I do have two additional folks with me today that's going to be presenting, so if we can go to the next slide, I would love to have them introduce themselves as well. But first, my name is Ben Hawley. I am the National Vice President of Distribution Channel Relationships, and I also have Dr. Arwen Decker and Kristen Rantala with me as well. So I will first turn it over to Dr. Arwen Decker to do a quick intro.
Hi, welcome to everyone. Thanks for joining us. I'm Dr. Arwen Decker. I am the North American Medical Director for UnitedHealthcare Global Solutions. Thank you.
And Kristen, who might be on mute.
Hi, Ben. Thank you.
Hello.
My name is Kristen Rantala, and I lead sales and client management for UnitedHealthcare Global. I am based in Minnesota, and I am passionate about mental health in the workplace. So excited to be covering off that topic for you later on during this presentation. And I have been a certified employee assistance professional for over 20 years. So again, very pleased that you were all able to join us today. Thanks, Ben. Back to you.
Excellent, thank you. All right, if we can switch over to the agenda, I will walk through that and then turn it over to Dr. Arwen Decker. So the first thing we wanted to do today is give you guys an update on data and trends. This is really what we're seeing in terms of current hotspots and where COVID-19 is prevalent at the moment, as well as I mentioned, give an overview and some strategies to consider for returning to work and how to plan for that in different locations around the world, returning to business travel, and also just considerations for travel in general, as we do know that employees will travel even if it's not work-related. As Kristen mentioned, she's going to walk us through behavioral health and mental wellness, and then questions and answers. So again, we're very excited to have you all with us here today. Just a couple of things for those of you who are out there. We will be sending out a copy of the presentation as well as the recording of the presentation in a link following the webinar today. So you will all get that, as well as a couple of supporting documents. In addition, we would love to have any questions that you may have as we're walking through this. If you could please use the chat feature to submit your questions, we'll be sure to get to those. We will have some dedicated time at the end for questions and answers, but as we're walking through things, feel free to type in a question, and if we can get to it as we are going through the sessions, we certainly will. Otherwise, we will collect those and cover off the questions at the very end. So again, thanks for being here. I will now turn it over to Dr. Arwen Decker to go through our first agenda item, data and trends. Dr. Arwen Decker, over to you.
Thanks, Ben. So we've been dealing with COVID-19 now for about 6 months, basically the first half of 2020, and the landscape for what this virus has done and where it's prevalent has changed a lot. So let's go on to the next slide, and we can talk about what's going on currently around the world. This is a heat map of the 5-day moving average of new cases around the world. Now, if we'd looked back on this, 6 months ago, a lot of that activity would have been focused in China and in the Southeast Asian region. But as we've seen over the last few months, the virus truly has become a pandemic, and the newest and most current places where it has reached an epicenter are in the United States and Brazil have become two of the most prevalent areas. India and Russia are not that far behind and remain areas where the virus is extremely prevalent and has been difficult to control. At the same time, what we've seen is that certain areas of the world have moved beyond their first wave of this virus, namely places like China, Australia, New Zealand, and parts of Europe have been able to get control of the virus, have been able to control its spread, and they are much closer towards opening up back towards normal activity. And I think as we can see the darker colors here, particularly in the Southern Hemisphere and in the Western Hemisphere, show that those are the hotspots where the battle against this virus have truly moved over the last few months. Areas around Africa and are sort of in the middle there, and that has both to do with data reporting as well as how prevalent the virus is believed to be in those areas. Okay, if we could go to the next slide, please. This is a map of the current activity throughout the United States broken down on a state-by-state level. The graphic line there shows what's happened historically over the past 6 months, and the colors demonstrate what's going on currently in these areas. The darker the red, the more the current activity is. Once again, the US, much like the world, has gone through a sort of a wave. Originally, when the virus hit the United States, areas that were really focused with high activity included major metropolitan areas on both coasts, including New York, New Jersey, the entire Eastern Corridor, as well as California, the West Coast, and Illinois and Chicago. Through some extensive work in social distancing and public health, we've seen that those areas have really dropped off really rapidly with stringent measures, including masks and social distancing. You can see here New York's graph has come down significantly, and they are very lightly colored, as is most of the greater Northeast. The West Coast has been seeing some increased activity of late, but otherwise had their areas under control, and Illinois and Chicago have also gone back down. Within the United States, the focus of the virus has really moved to the southern states now. Places such as Texas, Florida, Arizona have seen a strong uptick in activity. And we're seeing that along the southern border and the southern United States, we're seeing much more activity with COVID-19. Next slide, please. I'm going to hand it back over to Ben to discuss some of our return to work strategies.
Excellent, thank you. So we have developed sort of 7 factors for a safer and healthier return to the work site. So recognize that all of you on the phone and attending the webinar may be at different phases, but really wanted to call out some of the major points here to consider as you start thinking about returning employees to the work site. So the first is to confirm that the community is ready. And so as Dr. Arwen-Decker went through some of the current activities, that's really the first phase, is making sure that within that work site, the community there is at a point that is really suggesting that it's ready to start bringing people back to the office and to an office setting. And so certainly communities that are experiencing a lot of community spread currently, or where the virus is continuing to increase and spread, is probably not going to be ready. So confirming that the community and the location of that office and folks within community distance there are ready is really the first step. After you identify what sort of measures you'd like to look at for confirming readiness for the site, it's really to look at the work space readiness itself, and that would be things like how much capacity is there within the office, how many people can we safely bring back and still maintain social distancing. 3 would be preparing the employees to return. So there will be likely a lot of different protocols and The office space itself will be a bit different, so making sure all of those employees are prepared for returning to work, as well as considerations as to really who should be coming back to work. And we'll get into that in a little bit more detail as we go through this section. 4, communicate the plan to employees. 5 is actually bringing the employees back to that office site and that process. 6 is monitoring your progress, and 7 is continuing to support the physical and mental health needs. And again, Kristen's going to talk a bit more about that in the closing sections of this. So these are really the 7 factors that we are advising should be considered as you look at different locations around the world, and whether or not you're ready to start bringing those employees back. So let's go through these in a little bit more detail, and we can move on to the next slide. So the first is really assessing that community and the office location, wherever that may be around the world, and trying to understand at what point are we ready to begin our return to work process. And there's a couple of things that we just really want to make sure are highlighted here in terms of the regional readiness. The first, as I mentioned, is to look at the case trend in communities within commuting distance to the office. So is it going up? Is it going down? Is it fairly steady? How much is the community spread there actually taking place? And are we at a point where we feel like, yes, it's now a good time to start bringing those employees back to the office? One thing to really consider here, though, is that the testing prevalence around the world is very, very different in different locations around the world. So as people have been looking, for example, at bringing folks back to work within the United States, they've looked at the testing prevalence within the state, but generally speaking, testing is available. They have the resources to be able to do it and report those. That's not necessarily the case all around the world. So being able to really look at, is the location looking like it's ready simply because there's not good data and information available on the prevalence of the virus, and or is the testing prevalence in that location making it look like there are really relatively small cases, but again, it's only because they're not really testing. And we have seen this with some of our clients who have looked at a specific location, decided to open up that location because all of the data suggested that it was safe to do so, and within a few days had to actually close down and reverse because again, it really actually wasn't the case. There just wasn't enough testing locally, that the medical systems there didn't have the capability to accurately capture the picture. So really trying to understand which locations have the data that's available and reliable to make these decisions is really, really important. Also, other considerations that we should think about, one are, what are the local requirements and regulations in that particular location? So each different jurisdiction around the world have different protocols and guidelines as to how return to work should happen, and then most importantly, what should happen once you've brought employees back if there is either a confirmed case within that office location. What kind of capacity and protocols do you need to do? So certain locations would mandate that everyone needs to leave, the office needs to be closed down. Others are a little bit less strict. So really understanding, again, once we actually open this location and bring folks back, is it going to be the appropriate time? As it, again, if there is a confirmed case or there is a scare, are we going to have to then shut down for another 2 months? Is it going to be a week? Are we just going to have to notify employees, and really what your plan of action is going to be there? And then also looking at the capacity regulations. So again, these are different depending on which location you're in. Some locations would allow you to bring back pretty much your entire workforce if you can do so safely. Others are mandating that it be a percentage. So making sure that you have clear understanding of what the regulations are locally within that office setting, how many employees you're actually able to bring back under those local regulations is certainly important. And then finally, just assessing the healthcare services and capacity locally. So if you do have an outbreak there locally, is the medical system in that location going to be equipped and able to actually deal with it? Or does bringing people back together, again, pose too great a risk because healthcare services are still very limited? So those are some of the main things that we would really advise you to take a look at, as they can vary quite a lot from country to country. And in some cases, the amount of people that are able to come back and the consequences of having an outbreak would be would make it not necessarily make sense to do so. In other locations, the community could be completely ready, and bringing folks back is just a matter of let's get the plan in place and let's make sure to communicate it out. So as we've sort of gone through and decided, okay, we've looked at all of these factors, we believe now is a good time to start bringing employees back. The next phase is really to look at how you're actually going to set up that office space. So if we can go to the next slide, we have some best practices for that as well. As mentioned before, looking at the capacity by the office size is something that's really important. So how many employees can you safely bring back while still being able to set up your work site in a way that promotes social distancing and still protects employees? Having those clear guidelines on when to come in and when to stay home is also really important. So you've done everything you need to do. You've gotten your work site ready. Desks are 6 feet apart. Everyone has a good understanding of the physical space. The next thing to really make sure is that you have a process in place to be able to sort of monitor which employees should come and should not come on a daily basis. And there's a lot of ways that companies are looking at tackling that, but oftentimes it just means being very clear on, again, if you are sick or even a little bit sick, you need to stay away from the office for the time that you are symptomatic. And one of the things that we've been hearing in the market is the idea of a social contract. And this is really putting those protocols in place and having your employees really adhere to that social contract. So if you have a fever, if you have a cough, if you have a cold, not coming into the office, even if you feel like you could potentially perform the duties of your job, just making sure that they really understand that that's not something that is worthwhile and you should really stay home. And that social contract is something that we've seen to help get adherence to it. Having, again, the work arrangements to maintain social distancing, we've talked about that. A couple other things just to consider are what are going to be the procedures around common areas and conference rooms and meeting guidelines. So, you know, for example, the office kitchenette, and that's often a place where people congregate, and there's lots of people that are going to be touching and using all of those common areas. So what do we want to do there? Do we want to shut them off completely and just have employees avoid that? Are there going to be signs posted there so that people remember to follow the policies, making sure there's hand sanitizer and disinfectant stations around the office so that once they are moving around the office, they're able to keep clean and sanitized. Certainly also taking a look at the guest policy. So I know many companies have started to bring their employees back to work, but have very clearly stated that guests would not be allowed. So any kind of business guest still needs to stay away from the office. The employees are able to be there, but not sort of hosting events within the office space. And then similarly, actually prioritizing which employee type should come back. And so if you're going to, for example, say, okay, in this particular location, we feel comfortable bringing 50% of our workforce back, taking a look at those different job types and figuring out which ones really need to prioritize being in the office because they're really having a difficult time or are unable to perform the core function of their job outside of the office is really important so that you make sure that the employees that are being brought back are going to have the most productivity there, and those that still can maintain and do their jobs from home or away from the office are able to do that. This is one that was brought to my attention by a client who actually has a large building in Manhattan, and they were looking at actually physically getting people into and out of the building. So elevators, entry and exits. They have a 36-story building, and they calculated that by bringing everyone back to the office that worked in that building while still trying to maintain all of the guidelines would take approximately 4 hours to get every employee physically to their desk and 4 hours to get them physically back. So that's 8 hours of time getting to and from your desk during the day. And so, you know, clearly that they looked at that and said, okay, we're going to have to modify our plan because that's just not practical. So considerations like that are definitely important to look at. And then also looking at special considerations for those that are at high risk. So that is something that a lot of companies have said, let's look at our capacity, and then let's actually ask the employees whether or not they're comfortable. What are their circumstances that you may not know about in terms of any family members that would be at higher risk? Maybe they themselves are higher risk and just not comfortable coming back to that office setting. So really allowing them a choice to say, you're eligible to come back to the office. We're working through our capacity plans. Is this something that you would feel comfortable doing and that you are ready to do? And if not, that's okay. We will continue to have you work at home until such time that you are able. So that's something that we would really suggest, so that you don't put too much undue burden on the employees and potentially cause additional issues because of the specific risk status. And then finally, looking at mealtime and logistics, whether or not cafeterias are going to be open. I mentioned the kitchenette and those sorts of things. So those are all some of the physical areas that we really want to take a look at as we're actually bringing folks back to the office. Once you've got those sorts of things worked out, then we can start to move on towards monitoring whether or not the strategy is being successful. So we have some guidelines for that on the next slide. And one of the ways that a lot of companies have started to use and begin to track the success is through the use of technology and using data to monitor and track those trends. So here at United, we have an app that we've rolled out called Protect Well. It's currently only available in the US, although we're working on getting it to conform to international regulations as well. But that is really the use of technology, and there's a host of different applications out there which can be used to both track symptoms and allow people to either enter or exit the building, as well as monitor how many people are in the building at once and how many people have come in. The use of those sorts of technology can also help with contact tracing, which is another thing that is important as you're bringing folks back. So again, looking at those procedures, as if you do have a confirmed case or a suspected case of someone that was in the office, being able to notify those that they were around and who was in the office that day so that they can go out and get tested themselves. Again, technology has really played a big role in doing that. Making sure that you also continue to reevaluate the office location and the community at regular intervals. So again, as Dr. Arwendecker mentioned, as we went through the trends, if you had looked at the maps that we had shown 2 months ago, they actually would tell a very different story. And I know in just our organization, we had a number of locations across the US that were slated to reopen beginning in July. And because of the current situation, we have decided to delay that a bit. So making sure that you are continually looking at the data around the community and making sure that it still supports the strategies that you have is certainly important. Being able to also adapt to those tightening and loosening regulations. So in certain parts of the country, actually regulations are getting looser and you can have larger gatherings, and perhaps at that point you want to take a look at bringing some more folks back into the office and reassessing your capacity plan. Same thing is happening around the world. So certain locations have really gotten a hold for now on the spread of the virus and are able to support a little bit looser regulation. We know from, like an example in Beijing, China, where they had started to see some increase in cases, and then they really moved very quickly to lock down the city and those neighborhoods very quickly. Just having to be adaptable and maintaining and monitoring what's going on around the particular location and what the local health authorities are saying. For certain industries, health screening and actually testing capacity has been something that they have looked into. That has ranged everything from certain locations where they've actually set up mobile testing sites and are testing employees or would like to test employees every single day or every week. But just making sure that if that's part of your plan, that those capabilities are available in the location and can actually be carried out is certainly something to consider, as well as hygiene and social distancing. So we've said that a bunch, but that really is still the key. So even though you're going to be bringing folks back to the office, as they come back into that office setting and get more and more comfortable, there tends to be a bit of a letting down of the guard for folks, and they stop being as careful around their hygiene and washing hands and social distancing. So making sure to continue to really communicate with them and recommit to that social distancing is something that's certainly important to consider, as well as, again, just general adherence to the policy. So are people starting to come in even though they're not feeling great? Are they beginning to use things or go into spaces and overcrowd them and those sorts of things? So making sure that you're monitoring and having regular communication with the employees is really important. And that actually leads us into the next slide, which is all about communication and making sure that employees are going to be comfortable in this new environment. So the first thing we really recommend is to have regular updates from leadership. A lot of policies will have changed and are changing on a regular basis. So making sure those priorities and policies are regularly communicated out to the employees is really, really important, as well as having just increased time for discussion in team meetings as things change. Every time something changes, there will always be questions from the employees, and we found it to be very helpful to have some dedicated time set out for those questions, team meetings, as well as just general discussion. A lot of people are still in certain degrees of social isolation, bringing them back to the workplace. And oftentimes the workplace is one of the outlets that they have to be able to discuss what's going on, even if it's not necessarily work-related, having that outlet to just be able to talk about what's going on, as well as certainly, again, the comfort level that they have with what is the current plan, communicating those local policies, and also making sure to communicate out any changes or challenges as well as successes with the return to work policy. So there may be some unease as people are coming back into the workplace, but as that continues and as you have success, making sure that people know, hey, this is working. What we put together here, the plans we have in place have really been working. We've been back in the office for X number of weeks or months now, and we're happy to report that there have been no incidences. As well as if there were specific challenges, making sure that people are aware of those challenges, they know what happened and how they can be avoided. We also really stress reminding employees of all the resources that they have available to them. Many organizations have done a wonderful job of corralling the resources that they have and making sure that employees know those resources and that those resources are available to their families. So that's something that we want to just really continue to stress. Things like the EAP and mental health resources, which Kristen will walk through in a little bit, as well as any other programs that have been put in place. And then finally, ongoing contact tracing capabilities and communication to make sure that if there are any incidents or suspected cases, that anyone who was potentially exposed during the office that day is able to know that information, go out and get tested, and make sure that everyone remains safe. So that is a quick overview of the worksite readiness and several of the steps that really need to take place as you are planning for bringing folks back to the office, how to sort of set up the office space and some of those guidelines to consider, and then the communication, which again, communicating all of these plans is really, really key. So with that, we are going to switch over and also just wanted to talk a little bit about returning to business travel. This has been another topic that we've gotten a lot of questions on. I know that certain companies, depending on where they are in the world, have started to return to business travel. Others are looking at when it's going to be appropriate. So a few things just to consider around your travel policies. So we can go to the first slide here. The first thing, and probably most importantly, is to update the company's travel policies. And the most important thing is to really think about who should be able to travel, how often, for what types of meetings, and where. And so what we have seen is that in all likelihood, just returning to complete normal business travel, at least currently, is probably not going to be the best move. However, there are certainly locations and business travel that's taking place now. It's just really important that folks who are regular business travelers really understand what is essential travel. So if your plan is, for example, to restrict travel to just really essential travel, understanding what that is. Is it going to be something that is business development related? Is it client facing that's going to be considered essential travel? If those things can take place virtually, is that going to be something that's not necessarily considered essential travel? So for all of those people who are normal business travelers, these are the kinds of questions they're really going to need to know is again, what would be an appropriate use of travel at this particular point in time? And are there specific restrictions on where I can and can't go? So again, some employers have opened up regional business travel within their specific region, but have said no international travel. You can't travel internationally. I've talked to some other clients which have said, as long as you can get to a meeting and it is under a certain number of people and you can avoid mass transit while doing it, then okay. But other than that, you know, no travel. So really making sure employees are clear on what circumstances are they able to travel, what are we comfortable with as an organization in terms of where and for what type of travel, and then communicating those out is really the first step. From them, there's a couple of other things that can be done. Travel tracking and data has become very important so that as you look at movement around and as you return to travel, you're able to really see where employees are going. If there was travel to a particular location and then we noticed very shortly after a big uptick in community spread and cases, being able to communicate to those employees as to whether or not they should go get tested or stay away from the office. And that is another thing to consider, which is what is the self-quarantine policy going to be following travel? And that can apply for either business or personal travel. So in certain cases, if someone takes a business trip, would you ask them to stay away from the office setting for 14 days, for example? If they've gone on a vacation and travel to different locations, do you also want those folks to work at home for the 14 days prior to coming back into the office from when they get home? And making sure that those guidelines are really clear so that employees have a good understanding of what they should do following a business trip, and that could be either domestically or internationally. And then also, what are the risk tolerances of those particular employees? So there are a lot of people that did quite a lot of business travel, and some of them I know are very ready to go out and start traveling again. They feel confident, they feel comfortable in their ability and their ability to stay as safe as possible. And there are other employees who may have serious reservations because of either their personal situation, of those in their family or those that they live with. For example, someone could be caring for an elderly parent and feel the risk of going out and traveling again is just too great. So making sure that you have some contingency plans in place, similar to asking folks whether or not they were comfortable going back into an office setting and really providing them with a choice. It's also a good idea to do this with business travelers as well, to really try to assess, okay, you typically did a lot of business travel. Is this something that you're still comfortable with? Are you ready to begin that travel again? Or is this something that is not something that you would really feel comfortable at this point? And making sure that they understand that if that's the case, it's okay, and we can find someone else who is able to do that business travel and satisfy that until they are at a point that they are comfortable. The other thing really to think about is making sure that you have a proactive way to communicate what is going on. So whether or not it's particular alerts that get automatically pushed out to employees when they book a new trip, or have resources available for them to take a look at what the current state of those particular locations are. I know we're mainly focused on COVID-19 right now for this particular webinar, but there are still lots of other considerations going on around the world, security concerns, political concerns, as well as lots of travel bans that are in place. So making sure to check those before anyone would try to actually go. And then finally, the travel delay policy. So first of all, there are still limited evacuation and transportability around the world currently because a lot of those restrictions. Also, there are certain locations which are requiring people to self-quarantine. And so, understanding if someone does take a trip and they do get forced to quarantine either before or after that trip, what is the policy going to be there? So if they had a week-long business trip but are then forced to stay in isolation for 14 days, that adds on 2 more weeks to that trip. Is that going to be acceptable, or would we say, no, we're not going to lose 3 weeks of productivity so you can take a 1-week trip? And those sorts of things are certainly things to take a look at. So really would recommend just overall taking a look at the travel policies, really trying to define what's going to be an acceptable level of travel, where are the employees that we feel really must continue to travel to move the business forward, and are we prepared to be able to take on and react to any changing situations and or quarantine policies that may be in place. And then there are also, on the next slide, just a couple of practical things to take a look at, and I mentioned some of them here, but first is just checking the airline rules regarding self-quarantine prior to flights. I got a note on one particular airline that said, we're requiring everyone to quarantine 14 days before they get on the plane. And certainly when you're leaving for a location, not a big deal. Even if you haven't done it, there's really no way for that airline to know. But in this particular case, the trip that the individual who I spoke to was booking was only 4 days long. So the airline clearly knew that once they got to their new location, they hadn't been self-quarantined for 14 days. And so in order to take that trip and do their 3 days of meetings, they would have to add on an extra 14 days in order for them to actually get back on the plane. And in that case, it really didn't make sense for the organization to pay for hoteling for essentially 3 weeks for 3 days of meetings. So taking a look at what those procedures are and making sure that employees know whether or not that is really going to be acceptable or not. Communicating those clear guest practices for hygiene in airports and on planes, as well as regular updates on travel restrictions and watch flight cancellations. There still are quite a lot of flight cancellations that are taking place. So even if you're able to get a ticket to that particular location, in some instances, it's about 50 to 60% likely that airline is going to cancel the flight anyway. So again, you could be setting yourself up to get to the airport and do all of the things you're supposed to do simply to have your flight canceled. Even worse, that could happen wherever you actually are. So you were successful, you got to your destination, and now you're having a really hard time getting back because all the flights are being canceled on the way back. And then finally, having employees wear a mask, and when you're traveling, just in general, wearing your mask when you're in the airport, walking through on the plane, making sure that your hands are clean and that you have hand sanitizer or washing with soap and water certainly is very important to help sort of slow the spread and keep yourself as protected as possible as we go back to returning to travel. So with that, I know that's a lot to throw at you from a return to work and a return to travel perspective, but really did want to give an overview of the types of things we feel that employers should be looking at and considering as they start to bring people back to the office, start to allow people to start traveling again, and what to consider. With that, there are still a whole host of mental health challenges that go along with it. So bringing people back to the office, bringing them back to travel is going to create stress, and it's already a stressful environment. So we really wanted Kristen to come in, and I will turn it over to her to talk a little bit more about mental health and behavioral health as it applies to all of this. So Kristen, I will turn it over to you.
Thanks, Ben. And next slide, please. So as Ben mentioned, one of the things that has come alongside COVID, not only are people concerned about their physical health, their family's physical health, but they're also really feeling the behavioral impacts of COVID-19. And you take a look at this slide, and you can see that employees are feeling a real impact from both a mental health perspective as well as from a social well-being perspective. What we're seeing is that approximately 51% of employees are indicating that their mental health is somewhat worse or much worse than it was prior to COVID. And then even higher numbers from a social well-being perspective. So about 54% of employees are indicating that they're struggling from a social well-being perspective. One of the other stats that we have had reported to us is that approximately 40% of employees are reporting a decline in productivity. And you think about how all of these things play together from an employer perspective. So people who are struggling with their mental health, with their social well-being, and how that impacts their ability to show up in the workplace. Next slide, please. So one of the things we wanted to do was level set in terms of mental health well-being across the globe. And these numbers are not COVID related. So when I'm talking about not COVID related are the numbers in the circles. So 1 in 4 people in their lifetime will be impacted by a mental or neurological disorder. 2/3 of those people will never seek help from a professional. 76% of employees indicate that they're struggling with their well-being at any given time. And about 9% of employees have access to an employer-driven wellness program. And then one other stat we felt was really important for this audience in particular is that expats have 2 times the risk of mental health conditions. So you take these behavioral health and wellness stats and consider what we just talked about on the prior slide, where people are struggling more with mental health and well-being concerns, struggling with social well-being. A couple of other pieces we wanted to call out in terms of our international EAP services, and by international I mean outside of the U.S. What we're seeing year-to-date 19 compared to year-to-date 20 is an 18% increase in anxiety and worry, and that is for first quarter only. So think of January 1st to March 31st, just in that window, we're seeing an 18% increase. We also saw that calls and cases around parenting issues were up over 100% from last year. Much of that was in regards to questions about homeschooling and having one's children at home all the time. And with that, Erin, would you mind switching over to the next slide, please? I wanted to call these stats to people's attention because now is the time, as Ben had mentioned, now is the time to remind employees of all of the benefits, health and wellness benefits, mental health benefits that people have available to them. And one audience I think is particularly important. So your general employee base, of course, but also how are you communicating to your managers and your leaders within the organization? When I talked about that 40% stat, so 40% of employees are indicating that they're struggling with productivity or they've experienced a decline in productivity. One of the other things that came alongside of that was a pretty marked difference in terms of employees who had supportive leadership versus employees who did not have that supportive level of leadership. So we saw a difference in that productivity decline with employees who had supportive leaders. They indicated that they were doing better overall when they had supportive leaders. So bringing that back to communication, ensuring that your employees know what's available to them, but also making sure that your managers are communicating and that your managers and supervisors and leaders know about the benefits that are available to themselves, but also to the employee population at large. One of the things we wanted to call out on this slide was that the continuum of care and how these different levels of care address the varying severity of issues that employees might be dealing with. So if you have an employee who is, struggling with general well-being, maybe they're concerned about their job performance or their productivity, they might be okay getting information about self-care, helping them get access to self-improvement programs, maybe some apps that can help them with their sleep, or making sure they have access to mental well-being coaching, physical coaching, and how that can assist them. Then we move along that continuum, and people who maybe were struggling with anxiety or depression before COVID are really feeling those symptoms amping up. They're struggling with productivity, they're struggling with sleep, maybe their family or work relationships are suffering in a bigger way. Making sure that they know that those licensed counseling services are available to them, whether they be through their medical benefits or if that's available to them through their employee assistance programs. Again, making sure that that entire continuum of benefits is communicated out to employees regularly, communicating out in different ways, whether that be, via deep links that you have on your intranet sites, if it's by email, if it's in meetings, team meetings that are available, making sure that employees have the opportunity to hear that message multiple times and experience it in different ways. And Erin, I'm going to ask you to flip to our last slide. And we're going to open it up for questions. So with that, anyone have questions? Or Erin, do we have any questions that have come in during the course of the presentation?
Hey, Kristen, this is Lee, and I'd ask just as a reminder to folks that if you do have a question, feel free to enter it in the chat function at the bottom of your screen. We'll do our best to get to your topics. We do have a few that have come in through the call, so we'll try to address a few of these in the time remaining. So I'll pass these on to a few of you. But first of all, thank you, Ben and Kristen and Dr. Arwendecker for your information here. A couple questions for the panel. The first one I think is, Ben, an administrative question for you is, can we get a copy of the presentation and how can they get that?
Sure, yep, absolutely. There will be a copy of the presentation available. So following the webinar today, everyone will receive an email with a link to be able to download the presentation as well as a copy of the recorded presentation. We'll also send out some supporting information along with it. So you will all get an email. So take a look in your inboxes shortly after and you should receive it. If for any reason you miss it, please feel free either to reach out to myself or any of your local UnitedHealthcare Global contacts, either sales, client management, and we'll be happy to point you in the right direction.
Yeah, thank you, Ben. And there's another similar question related to that. And you had referenced in your materials the 7 factors for safe and healthy return to the worksite. You'd mentioned that there's a report that the information was pulled from. Will that particular report be available for folks?
It will, yep, absolutely. So that will be sent out if you would like a copy as well. For anyone else within the organization, again, just reach out to us. We're happy to point them in that right direction. But yep, that's one of the supporting materials that will go out.
Okay, thank you, Ben. Kristen, a couple of questions came in on behavioral health and in related topics. And the first one has to do with international EAP, and in your materials you had referenced this is a key part of the program. And the question is there an app that UnitedHealthcare Global provides for international EAP?
Sure, yes, Lee, there is. Thank you for that question. And we at UnitedHealthcare Global use the Optum My Wellbeing app. And one of the things that is really lovely about that app is it offers the opportunity for people to engage in essentially an online health risk assessment. But with that health risk assessment, people are drip-fed questions 1 or 2 at a time over the course of many days. And as they take that health risk assessment, it generates a health score. And people can see how their everyday activities impact their health. The other piece that's really lovely about that app and those questions, there are a number of questions that are related to behavioral health, mental well-being, and if someone were to answer a question in a way that indicated they were struggling with work and life balance or stress and anxiety, for example, they would be pushed a message that said, did you know that you have an EAP available to you? And they would be given the opportunity to click to call the EAP right in that app. So we're really trying to marry the physical well-being, mental well-being, all of those services together in one app so people can get the information and help they need immediately.
Great, thank you, Kristen. And a similar question around EAP is, the question is, excuse me, is EAP included with UHC Global Insurance?
Yes, it is included in our expat medical programs as a standard offering.
Okay. Looks like we have two more questions to address here. Dr. Arwendecker, if I may come to you for a clinical question. Question is, would you recommend the employees get tested even if these tests are not FDA approved?
That's a great question, Lee. So there are a lot of tests available, and the FDA has been trying really hard within the US to try to get as many tests out as possible that are of reasonable quality. If you're in the United States, we would really not recommend you take a test which is not FDA approved. This is particularly common, especially in the space of antibody tests. There's a lot of antibody tests you can get over the internet, which you can take at home. Unfortunately, what we found is that those tests are not reliable. They can give you inappropriate results, and if you're going to be making decisions on who can come into the office, who is healthy, who is safe, who is not, we would not recommend those tests. Outside the US, there are similar organizations around the world who are trying to validate which tests are appropriate and which tests are not. There are a very small handful of antibody tests which are reasonable. Many of them are not. And all of the other tests for COVID, particularly the PCR tests, the nasal swabs, if you will, require a certain degree of sophistication, which you typically can't do unless you have some sophisticated equipment and people who know how to use that equipment. So in short, I would not take an unapproved test. It will not be helpful for your decision making.
Okay, great, thank you. I guess yeah, one other clinical question, Dr. Arwendecker, and you had referenced in your slides a lot of information in terms of the spread of COVID and some of the data supporting that. And the question is, do you have particular sites that you would recommend folks could also look at to keep on top of some of the latest trends?
Yeah, there's a couple of good ones. The Johns Hopkins website is very good at giving current information around the world. If you're looking for information specifically within the U.S., the IHME site is actually excellent. And if you need recommendations on what you should do, what next steps you should take, and if you have concerning symptoms or are worried about yourself or someone else, the CDC and the World Health Organization both have sites which can help give you some advice. They have symptom checkers and can give you an idea of what guidelines you should follow as you consider making plans for yourself and your workplace in this environment.
Perfect, thank you for that. Okay, one last question, Ben, coming to you on this, and then have you close us out after that. So the last question we have is that you had referenced an app that UHC and UHG are using as a screening tool and a symptom checker. The question is, what's the name of that app, and what is the availability of it currently?
Sure, yep, that app is called ProtectWell. It is currently available within the US, and the reason for that is that the app is designed to follow the CDC guidelines for returning to work and symptoms related to who should and should not come back. We are currently in the process of inputting other guidelines for other countries around the world. So currently it is really appropriate for use within the United States, but we are working on expanding that so that it can follow the guidelines of other jurisdictions and other health authorities. So we will certainly stay in touch with everyone on when that becomes available for use outside the US. Again, we're working on it now. If you're interested in taking a look at the capabilities for use within the US, please let us know. We're happy to share all of that information with you. And again, we'll stay on top of making sure everyone is updated once it becomes available for other locations outside the United States. So with that, it doesn't look like we have any other questions in the chat. I want to thank everyone very much for attending today. Again, if you have any questions on the presentation and we're not able to get to it, please feel free to reach out to us and we will be happy to connect with you. I also did want to mention that this is really one of our kickoff webinar. We do plan to host a number of additional webinars where we will dive in a bit more detail to the topics that we've covered today. And so please look out for additional invites. We would love to have you all back again as we look at some of these issues in a little bit more detail. So thanks again, everyone, very much. Thank you to Dr. Arwen Decker and Kristen for your participation today. And we look forward to seeing you again on a future webinar soon. Thanks so much, everyone. Bye-bye.